Coming up, we will be on location at Visage Dermatology in Largo, Maryland, discussing the latest advances in skincare and how they can help rejuvenate your appearance and give you the beautiful skin you've always desired with one of this region's top dermatologists, Dr. St. Surin. Dr. St. Surin received her medical degree from Howard University College of Medicine. She is a fellow of the American Society for Dermatologic Surgery, as well as a fellow of the prestigious American Academy of Cosmetic Surgery. Welcome, Dr. St. Surin. It's a pleasure to have you on our program.
Thank you. It's a pleasure to be here.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have some patients, I believe, that you're going to be demonstrating treatments on, as well as that we're going to interview and tell us about their experiences. But I wanted to begin, if I may, Doctor, by having you tell us about some of the treatments that you offer here at Visage Dermatology.
As a board-certified dermatologist, I still do a lot of dermatologic surgery. So if a patient has a mole or a skin cancer or anything that needs to be removed, I do the surgery myself. I remove it. I do some medical dermatology and a lot of cosmetic dermatology as well. That is my love. We do Botox. We do fillers. I do a lot. I have a nice laser that allows me to do a lot of different things, from laser hair removal to fractional resurfacing, and even to actually reduce pores and fine lines. I do a lot of chemical peels. So we kind of have something for everyone here. But the latest thing that we started to offer at Visage, the latest service, is the Rejuvepen, and it's actually the latest in microneedling, and it's my baby, and I love it, and the patients love it. And with the Rejuvepen, I can go on and treat the wrinkles around the eye, stretch marks, acne scars, and even around the eye for men. Absolutely wonderful. My male patients love it. It treats the wrinkles around their eyes as well as around the mouth, and any acne scars that they may have gotten as teenagers. And with the male aging face, sometimes we see that acne scars look a little deeper and they furrow a little more. And so with the Rejuvepen, it kind of erases that, and they're happy. And so I've got something for everyone here at Visage. So we have a nice array of services.
That's wonderful.
Yeah.
And the Rejuvepen is something I wasn't familiar with until now. And it sounds like a wonderful treatment option that can help so many folks.
It can. It can. It's wonderful, and it has almost no downtime, which is very important in this area. In the DC metropolitan area, people are very busy. People have a lot of activities going on, and a lot of times you cannot lose 7 to 10 days from work or from social activities recovering from a procedure. For some people where that's necessary, that's great, and they can do the time. We normally offer those services and procedures around the holidays or around their vacations. But for the person who really can't do that or just wants a little spruce up and doesn't want anybody to know, we even have lunchtime peels where I can peel your hands, your face, your neck, around your eyes and your lips. Basically send you to work like a new person, but no one knows that you've gotten anything done, and it's done so quickly, and it's wonderful.
That's great, and I love the fact that, for like you touched on a moment back, that you're talking about busy professionals, busy folks, especially in this region, and these folks can get the benefits of the skin rejuvenation and the other treatments that can help them look younger quickly. We're talking, like you just mentioned, at lunchtime even, to come in, have this done, and go back, and nobody even knows that you had anything done. It looks so natural.
Exactly.
Now, who would you say would be a good candidate that can benefit from some of these treatments that you've touched on?
Pretty much as long as you're healthy and there aren't any contraindicating factors, you could pretty much do it. When I say contraindicating factors, like, well, if you're allergic to something in the chemical that I'm using, of course, I wouldn't give it to someone like that, but that's very rare. I go from treating teenagers to people in their 70s and 80s, male, female, it doesn't matter, and all complexions, all ethnic backgrounds. There's something for everyone. And the thing is, there's no one treatment for everyone. So when I see a patient and they come in, I look at you, I look at your skin type. And that's basically, you know, your skin complexion. How light are you? How dark are you? How will your skin react? Also, well, how much time do you have in your schedule? What's your social schedule like? How much time are we working with? Is there a wedding, or is there a social event that we need to work around? And that's how, you know, I kind of cater every service and every treatment to that particular patient. So nobody's going to walk out of here getting the same exact thing a lot of times. So somebody will say, well, my friend got this, and and I want this, and she looks great. And I'll look at you and say, well, that may have worked for your friend, but your skin's a little different, so let's see what we can do for you.
That's wonderful.
Yeah.
So basically you customize the treatment option or options based on each particular patient's needs.
Exactly.
That's great, doctor.
Yeah.
And I wanted to ask you if you can tell us a little bit about how some of these treatments are performed.
Okay.
What is a patient looking at?
So what a patient's looking at, let's say if I did Botox on a patient, you're not going to get your result right away. It's a series of tiny little injections depending on the area that you want to treat. This is a very popular area, the brow area or the forehead area. You come in, you cleanse your skin. If you have any makeup off, we cleanse it, and then I rub it off with some alcohol again to make sure that the skin is totally clean, and beep, 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 you're on your way. Okay? That's it. You're on your way. If this is the area that we're dealing with, you've got 3 shots. Some people might, require a little more. It feels like a tiny little bee sting. And within 4 to 7 days, you start to kind of feel it working, and it really puts in a punch and really fully relaxes around that 7th to 10th day. So that's wonderful. If you want a result right away, depending on the patient and what they come in for, so I want to fill a little bit here, or, I want under my eyes to be a little fuller. I've lost some of the, some of the fullness under my eyes and in my cheeks. Well, if I were to do a filler, whether it was Juvederm or something, or Bellatero, any of those fillers or hyaluronic acid fillers or others, you get an immediate response because I'm replacing volume, I'm filling. So that's something that you can actually walk out and have an immediate response. But I also do it gradually, where people will see you and they'll say, something looks different. Did you go on vacation? What did you do? But no one can tell that you've gotten anything done. And I think that's the mystique of it, and that's what makes it look beautiful. You look refreshed. You've come from vacation and you've gotten something done, so nobody can tell, and you look younger. And so that's one of the things. Now with a chemical peel, if we were to do that, you come in, we prep your skin, we cleanse it, apply the chemical peeling solution. You may feel a little tingling, and based on your tingling is when I would stop the peel. About 3 days later, you start to see little brown flakes and scabs, and 4 to 5 days you peel. By the 7th day, it's completely done, and you've got a fresh new layer of skin. The skin looks radiant, it looks polished, it looks great. You just got to be willing to put the little time in with the little flaking.
And can a patient choose to utilize a combination of some of these procedures?
All the time.
Cover different areas and have work done on different parts of their face and their neck?
All the time. Again, with people's time constraints, a lot of times someone will come in and leave with 3 procedures. So it's not rare that I will do your Botox, your filler, your hand peel, and your neck peel and send you on your way. and when I say Botox and filler, it's not just on one area too. It may be several areas on the face. So yes, we definitely combine procedures.
Now, and what type of results, Dr. St. Surin, are we expecting or looking at from these treatments?
Okay, from Botox, we relax the muscle. There's nothing that's paralyzed. It's relaxed, and it gives you a relaxed look. So I always tell my patients, relax, and relax with a little Botox, okay? And then with your fillers, because the relaxing of the muscle is going to prevent that brow furrowing that we normally see that give patients an angry appearance. And what we also love with it is sometimes patients can get a brow lift, which is nice because even when you're tired, you look refreshed. You don't look tired. And with the fillers, you no longer have folds, you no longer have depressed areas. Everything is kind of fuller, younger appearing. Like you did, sometimes patients will bring me a picture of themselves in their 20s and 30s, and I say, okay, this is what your cheeks look like then. Okay, now we're 40 and 50. I see where we're trying to get to. And so we kind of work towards that goal again. And with your chemical peels, what you're actually getting is you're getting an improvement with acne, you're getting a reduction in acne lesions, you're getting a reduction in brown and red spots. You're also getting a reduction in your fine lines depending on how deep the chemical peel is. With my superficial peels, you're getting less wrinkles, you're looking great, you're sprucing up before that special occasion, and with my deeper peels, you're looking younger. You're looking really much younger.
And I love that because not only are you looking younger, but you're looking younger in a very natural way. You don't look like you had something done, in other words.
No, you don't look like you've had something done. And so, and it depends on the patient. If somebody totally wants nobody knows, sometimes somebody doesn't want their spouse to know that they've gotten something done. We can take care of that too.
We're now going to meet a couple of patients of Dr. St. Surin. Welcome, Donna. It's a pleasure having you on, and we always appreciate it when patients come down and share some of their experiences with us.
Thank you. It's very nice to be here.
Now, let me begin by asking you, Donna, what brought you to Visage Dermatology?
I'm getting older, and there are certain things that don't look as nice as they used to. Brackets around my mouth and wrinkles and things that were just getting worse, and just a variety of kind of more facial things.
Was it affecting your confidence and self-esteem in any sense?
It has been making me feel older as these things were developing. I generally kind of live around them, but they're there. You know they're there.
It's just part of aging, right?
That's right.
So then you became more conscious of it and then said, listen, I got to do something about it, right?
Yes.
And that's what brought you here to Visage.
Yes.
And what happened when you got here with Dr. Saint Surin?
She had the pearl fractional, which is essentially a resurfacing method, and she felt I was a good candidate for that. So I had the full face pearl fractional, which has made quite a difference in especially my mouth brackets, which have basically disappeared, and the other wrinkles, which were far more visible, some which you're not really even aware of till they're going away. Because you know, you get used to the way you look, and when you change that, you suddenly realize that, you know, that there were a lot of things that were there you hadn't really realized had crept up over time.
Yeah, so you had the perfractional laser treatments.
Yes.
And obviously, as you just touched on a moment ago, you're very pleased with the results?
Yes, I am. I am very pleased with the results.
And for the folks out there that are watching, Donna, what would you tell them about not only your experience with Dr. Saint Surin, but her staff here at Visage Dermatology?
Well, Visage Dermatology has a very nurturing environment. Everyone here is very caring, they're very pleasant, very helpful. They try to make it truly a pleasant experience and help you as you go forward after you've had it with caring for your skin.
Well, on that note, we'd like to thank you again, Donna, for coming down and sharing some of your experiences with us. It was a pleasure having you on.
Thank you very much.
And you look great.
Thank you.
All right. Welcome, Sandra. It's wonderful having you on the program as well.
Thank you so much for having me.
It's our pleasure. And I wanted to begin by asking you, Sandra, what I just asked Donna a few minutes ago, and that is what brought you to Dr. Saint Surin and Visage Dermatology?
Basically, I've always suffered from acne. I had some scars, some acne scars. I had large pores. So I just wanted to see if, you know, if I could find a dermatologist that could actually fix it for me or make it better.
So then what brought you here specifically? How did you hear about Dr. Saint Surin?
I actually saw a flyer in one of the little cafes around here. Okay. So I decided to give her a try and fell in love with her from the first day I came.
So you were, like you said, very comfortable with her. You fell in love with her because it's really a trust issue when a person chooses a doctor. You have to be comfortable with that person, someone you trust, and you felt that with Dr. Saint Surin.
Absolutely, with the whole office staff. Everybody was just so friendly. She made wonderful suggestions. You know, she shared some of the things that she's been trying to, you know, accomplish as far as her skin, which was similar to what I was going through. Oh. So that made us, you know, we had good chemistry, so.
Interesting. So what treatment or treatments did you have done?
I am actually doing the microneedling. I think it's called Rejuvenation. Oh. So today is going to be my second session with it.
Wonderful. That's the treatment that she's been telling us about.
Love it.
Yes, so you're very happy with the results?
Oh, I'm extremely happy, and I only had one session. So I can only imagine how much better the texture of my skin is going to be after I'm finished with the process.
So in other words, from what you just said, you've already started seeing results after one session?
Absolutely. I saw the difference in my texture, the smoothness of my skin. My pores had definitely shrunk. You know, the scarring was lighter. So I am more than excited about the process so far.
Well, I'm very happy to hear that. And before I let you go, Sandra, for the folks out there that are watching, what would you tell them about not only Dr. Saint Surin, but the experience with the staff here as well?
I would definitely say if you're in the area here in Maryland, you definitely should come visit Dr. Surin if you're having problems with your skin. They're very warm, the staff. You know, every time I have a procedure done, I always get calls for the next few days to check on me to make sure I'm healing well. So I would definitely say give them a try. The best dermatologist I've had.
That's wonderful. That says it all, actually.
Yes, it does.
And on that note, Sandra, I'd like to thank you for joining us and sharing some of your experiences.
Thank you. Thank you so much for having me.
It was our pleasure. We're now back with the doctor. The patient seemed very happy with the results.
Oh, thank you so much. It's my pleasure. I love to hear that.
Now, are there any follow-up visits that are required, doctor, for any of these treatments you've been telling us about today?
Well, yes, I tend to like follow-ups. Some of these procedures, like some of my lighter peels, they're not one-time procedures. You'll need 3 peels, maybe 10 days apart, or 3 peels, each of them 15 days apart, and then you're kind of pretty much set for the rest of the year. But we definitely like to do follow-ups because I want to see if we're getting the result that we want. Maybe we need to tweak something. Maybe we have the result that we want, and I don't need to see you for another year unless you want anything else done. But we always love follow-ups, and I love before and after pictures, and it warms my heart when you actually show a patient their before picture when they've been looking at the after for 3 months. They're like, oh my gosh, that was me. And that's priceless.
I'm
so
sure
follow-ups
it is.
are great.
You're making people feel younger, look younger, not to mention more confident as well. That comes with that.
Yes, and that is an added bonus. Yeah.
Now, how long do these results typically last? And I understand it depends on the patient, the treatment, so on and so forth, but in general, what is someone looking at?
Okay, with your neurotoxins like Botox, you're looking at anywhere 3 to 4 months, sometimes even longer. Some patients, they last 6 months. That's if I'm using it on the face. If I'm using it for excessive sweating in the armpits or anywhere else, they can last 6 months and a little longer. With your fillers, you're looking at least 8 months to a year. And with your chemical peels, it's pretty much, pretty much long lasting as long as we don't go out and do more sun damage or anything like that. But I have a lot of patients who just love to get their chemical peels because the skin just looks better and better, and so we might repeat another series or we'll do it next year, which is really nice. But once you produce collagen and you do the procedures that get you to produce collagen, like my laser genesis procedure or my rejuvepen procedure, or even injecting a filler, once you inject that Juvederm in there and the patient starts to produce their own collagen, that lasts forever because you're actually building collagen.
Very interesting. Yeah. Now, we're literally out of time, Dr. St. Surin, but I wanted to ask you before I let you go, you and your practice, Visage Dermatology here in Largo, Maryland, have certainly established a reputation for excellence in not only facial care, but skin care. You're one of this region's top dermatologists. I just wanted to ask you, what would you say helps separate you and your practice from many of the others?
One thing that definitely separates us is we like to make the experience from the moment that you call to the moment you walk in, you're seen, you're treated, and you walk out the door. We like to make that a good and a memorable and a positive experience. And the fact that we actually work with your schedule and tailor each treatment towards you, your lifestyle, and your schedule, and that's very important. And as long as someone feels good about themselves, I've done my job. I always believe that you should feel better once you've walked out of Visage. You should feel better than how you felt when you walked in. And if you felt great, well, guess what? You should still feel better.
Yes.
And that's what's wonderful.
It's very personalized, right down to the staff here and how they look after their patients, from what we've seen and heard from our research as well.
Yes, and no human is the same, so.
Yes, and on that note, Dr. St. Surin, I'd like to thank you for joining us, being a guest in our program. You really educated us on multiple treatments and in skin care, facial care, and how we can benefit from them. And we'd love to have you back on in the future.
Thank you. I'd love to be back.
Thank you.
Okay.